Let me tell you about something that doesn't get talked about often enough. With sickle cell patients, you don't always collapse when something serious is happening. And that's something you must actually never forget. Sometimes you just start coughing. And when you're coughing, you might feel like your chest is, tight somewhere there. And then sometimes you're even feverish and tired. So some form of a fatigue. And hours later, what could be happening is that you're fighting for oxygen. You're grasping for breath, like, why am I not getting enough oxygen? That situation is literally referred to as acute chest syndrome. And today, what I'm going to be doing on this video is I'm going to be talking about acute chest syndrome in a way that you can understand it, learn about it, prepare for it, and be ready. Hopefully stay out of the emergency room for acute chest syndrome. Now, if someone you love lives with sickle cell, please stay with me. If you are thriving with sickle cell, absolutely stay with me. My name is Opemipo, and this channel is talking about how we can thrive with sickle cell anemia. I'm not going to be sugarcoating things. At the same time, I'm not going to be making you afraid. However, I want to give you the tools to ensure that you are prepared and you avoid the emergency room in the name of acute chest syndrome. We don't want the emergency room to be the first place we hear about ACS. So we're just going to change that situation now. Acute chest syndrome is one of the serious complications of sickle cell disease or sickle cell anemias. Doctors usually diagnose it when there is a situation when there is a scan at the lungs, combining with other things that are presenting like chest pain, fever, difficulty breathing. And the dangerous part about acute chest syndrome, to be honest, is that it doesn't arrive dramatically. It's quiet, it looks like pneumonia, it resembles a cold, and sometimes it can feel like a normal pain crisis, and that's why it really gets underestimated. People usually just say, I'll rest it out. That is a common thing with sickle cell patients. Or I'll take it easy for a few days, or I'll drink more water, or I'll see a doctor in the morning. However, delay in going to see a doctor can change everything. So let's quickly take a deep dive into some of the warning signs that somebody who is living with sickle cell may experience when you're dealing with acute chest syndrome. So if you have any experience with chest pain, coughing, fever, breathing, and breathing becomes something that you are now working hard to do, and you may be looking like you're wheezy or difficult to get oxygen, as a matter of fact, it is time for you to actually start considering going straight to the hospital for a checkup. The doctor is going to read your lungs and then start helping you to think about the things that you need to do. Because once breathing becomes the real work, it's not just pain, definitely your lungs are involved. So why does ACS happen? ACS again is acute chest syndrome. It usually comes from one or more of two things working together. So the first one is that it could start with an infection, a virus or a bacteria that inflames the lungs. When you have those type of things, it could actually cause ACS. The other part of it is that sickled red blood cells can actually block flow of blood in the lungs, and it reduces oxygen in your lungs. And sometimes during severe pain crisis, fat actually leaks from your bone marrow into your lungs. These things are some of the things that we cannot explain. Our doctors have not been able to explain. So it's important for us to know about it, prepare for it, and always pay attention to little signs that can read acute chest syndrome. Honestly speaking, it is a very, very complex lung emergency, and the reality is that it is one of the leading causes of hospitalizations, I dare say fatalities or fatal incidents with sickle cell patients across the globe. So people can really go from feeling somewhat uncomfortable at the initial stage to being very, very sick and needing the opportunity to be in intensive care less than 24 hours from the first moment they started feeling uncomfortable. This is not supposed to scare you actually. It's supposed to prepare you and inform you, like I've been saying early. One of the things that people say is that early care saves lives. So the earlier we know about this, the earlier we get in front of it, then you might actually be prepared to survive an episode of acute chest syndrome. So let's take a deep dive. If you actually are a sickle cell patient and you suspect that you have ACS or you might be experiencing ACS, one of the things you have to go and do is go to the emergency room and say these words clearly. I have sickle cell and I am concerned about acute chest syndrome. This is not something you're going to say like as if, oh, it's just something mild. You're going to not downplay it. You're going to make it very serious and make the doctors or the nurses aware. If you cannot go to an emergency room, please go to the nearest hospital. Go to the nearest, medical facility around you that you can see. Your life matters and you are the number one advocate for your life. Now, what do the hospitals do if they are treating acute chest syndrome? Of course, they're going to do usual pain control. They're going to give you IV fluids. They're going to give you antibiotics if they find an infection. They will help you with your breathing. They're going to put the oxygen mask. And the goal for that situation is restore oxygen or reduce inflammation or basically push out the sickle cell from blocking the flow of oxygen to your lungs. And as soon as that starts to happen, you will begin to feel better. So acute chest syndrome is not something that should kill you, but not knowing that you are dealing with ACS or getting information about ACS for the first time in the emergency room is probably not the best thing for you. And that's why this video is going to change that. Honestly, you're at risk of ACS each time you have a prolonged crisis, and you want to treat infections early so that it doesn't lead into anything that's going to impact your lungs. If you have infections, please treat it early. As always, the golden rule for sickle cell patients: stay hydrated. That has occurred several times in my video. You want to avoid smoke exposure. You want to keep your vaccines current. All of these are things that can help you to reduce, or prevent acute chest syndrome. One of the other things you can also do is to ensure that you manage pain promptly so that breathing doesn't become shallow. If that happens, obviously you're not going to get enough oxygen in your lungs. Now, you have to be able to tell your doctor about past episodes of ACS if you've actually experienced ACS before. This is the information you already have. Please use it to your advantage. Tell your doctor about it. I had ACS at this point. This is what the doctor said. Because then they know. Because once you have it the first time, chances of repeat occurrences is very, very high. That knowledge changes things for you, gives you leverage, and helps the doctor to know where and how to start. If you know what ACS means or looks like, obviously you can act faster, and thereby you can live longer and thrive better with sickle cell. If you're never helping yourself and you're helping someone you can also identify it in other people and say, hey, why don't we go to the hospital? Why don't you see a doctor? Why don't we say you're not treating things at home that you really shouldn't be treating, and you're actually getting the best advice from a professional when you first see symptoms. Again, if you attend to anything early, guess what? Lives are going to be saved in terms of ACS. So the bottom line here is that ACS is a complication that you don't want to hear about for the first time in the hospital. It's a complication that you can totally work at or identify. It's a condition that you can, get in front of. We're not perfect, we're not God. We don't know what's going to happen. But once you start feeling slight symptoms, slight signs that look like ACS, absolutely get up and go to the hospital. It's not something you want to postpone or something you want to leave till later. At the end of the day, my goal is to ensure that you have the tools to live healthy, thrive with sickle cell, and have a wonderful life with all the information that you know or you have from this video about sickle cell. Now, if this video has helped you, the usual: like, share, subscribe. If you think somebody needs to hear about it, tell them about it, because ACS is not really a joke. And we're talking about ACS today because it's kind of still cold where I am. It usually happens within the cold seasons, cold weather, exposure to cold. That's also something you want to avoid. As a rule, avoid infection. That's always my motto. And I'll see you in your 80s, 90s, and even 100s thriving with sickle cell. See ya.